Hello, everybody. My name is Al, and I'm with People Advocating Cannabis Education. PACE is about PACE is about people who promote the benefits of cannabis, and we do that through public education. Today, we are at the Studio Cafe in Belleville, and I'd like to introduce you to a cannabis advocate who will talk to us about the alternative, non-smoking ways of using cannabis. I'd like to introduce you to Adam Greenblatt.
Hi.
Hello, Adam.
I'm Greenblatt.
Greenblatt. Sorry for the pronunciation.
Greenblatt would be cool.
I guess it would be. Can you tell us a bit about yourself as far as like your hobbies? You know, maybe if you've got any special education and what you do for a living, just to let people know who you are.
Sure. Well, my name's Adam Greenblatt. I've been an advocate for cannabis law reform for I guess officially for 8 years. I've been working in the medical marijuana industry for 6. I'm currently the director of the Medical Cannabis Access Society in Montreal, which is an incorporated nonprofit, and we run a dispensary and a cannabis bakery through the Access Society. Education-wise, my formal education is in languages, and adventure therapy and education, but I made a career change early on, and I've been working in cannabis for 6 years now. So.
Outdoor education, cannabis, it all sort of, I'm sure, can work together.
Yeah.
Hey. Can you tell us a bit? You mentioned the Medical Cannabis Access Society, the Compassion Center. Is there any bit of a history, anything that you could
Sure.
tell us a bit about that?
The MCAS was founded in 2010. We're an incorporated nonprofit. We've been around for years now. We operate a dispensary in Montreal. We also operate a medical cannabis bakery. We specialize in the production of cannabis-infused goods, tinctures, various extracts, and that's what we do. Yeah. Our edibles are available in Toronto through Medical Access, and you can also be accessed directly through us if you're patient with us.
You see the hat I got on there, eh? Can you read that? So as far as joining your society there, what does a person go through in order to be able to become a member?
Depending on the condition, to join the organization, we need at least a statement of diagnosis from your treating physician. If you already have your Health Canada MMAR license, you can to apply as valid. But we also accept patients with statements of diagnosis, depending on the condition that they're presenting with. So that's how you would join, just like any other dispensary in Canada, and we're not as open about. I mean, we don't have a sign out front. Our office is confidential, and we don't advertise the location. We consider ourselves to be a bit more discreet, and that is to protect the safety of our patients and our organization, because as you know, this is still a murky area of law, and dispensaries remain inadequately regulated, and so yeah. But
a bit of a gray area, some people say. So as long as the doctor signs, so really you don't really have a list of eligible conditions. It's just as long as the doctor approves.
For the most part, yeah. For the most part, it's recommendation. I mean, the large majority of our members have their MMAR licenses already, but in Quebec especially, it's very difficult. The doctor shortage problem for medical marijuana is especially problematic in Quebec because the College of Physicians here is quite conservative, and doctors have been explicitly discouraged from signing MMAR forms. So there are actually a lot of physicians in Quebec who are actually more okay with signing a statement of diagnosis type document rather than going through the entire Health Canada process. So, for example, we have a lot of, well, I mean, but it is becoming more and more common. More doctors are becoming educated about the MMAR, but at the same time, the majority of patients can't find the physician who will support their MMAR application. So.
If there's any question that you don't feel comfortable answering, just let me know, okay? Do you guys, like, I know some dispensaries, they'll do mail delivery, phone ordering. They don't require the patient to actually come in.
We do mail order as well. So we have our dispensary location is private, so that our sort of local members come and visit us in the office. But we serve patients all across Canada.
Okay, that's what I was going to ask. Yeah.
Just like any other dispensary. Well, I guess not any other, not relevant to it, but we do mail order, and members who order through mail can actually log in through our website and place orders online.
Oh. Now, wouldn't mind moving a little bit over to your website. Do you know much about your website? What all you can tell us about it? Yeah, the Medicinal Cannabis Access Society website. I was there today checking things out.
Well, we have a section.
See you all was there.
It's mostly for acquiring new members, and there's sections on vaporizers and edibles and dosing and titration. We really try to do, with every new patient that comes in, we do an in-depth sort of orientation session with them. We go over their history, their experience using cannabis, and we try to make some recommendations based on that. And we really work with people to meet their treatment objectives and to really dose and titrate cannabis appropriately. Because especially today we're talking about non-smoking alternatives, dosing and titration,
right.
Finding the right dose, when you should take it, how you should take it. All of these, for new patients especially, it's a long process of trial and error. So we really try to coach them through this as best we can.
And from what I saw there today, that's a button that they can click on called Cannabis is Medicine, where they can go in and learn all these things.
That's right. We try to. It's still in the works. Our website is still somewhat of a beta. We still have to translate it and finalize some of the info, but you can get information on dosing titration there. We have a log sheet for new patients to keep track of the types of cannabis they're trying, or the types of edibles or the extract, what their effects are, because it's only by keeping track of it that you can go back and see, well, what worked for me, what didn't work for me.
Yeah, I also noticed you guys got a little bit of video there. There's actually a little video there of Dr. Abrams, and you got a Twitter feed showing the Twitter comments and stuff. So you're getting into the social media and stuff added on there.
Hang of it, learning the WordPress, learning Twitter and Facebook and all that stuff. I try to change that video every now and then. Before that Donald Abrams interview, we had that. There was a Drug Policy Alliance video called The Flower. It was like a cartoon. Yeah, you've probably seen it. It's a cartoon of this society. It's growing this wonderful flower. I don't know. I can post the link here.
Yeah.
But anyway, we're trying to make the website more dynamic, and we're going to be having regular blog posts. We've also got a bakery blog in the works.
Yeah, I noticed you got like a bit of a picture slideshow on the main page, and you're showing some of those baked goods, like the chocolates and things go by. So they do look very delicious, just so you know. Okay. Has anybody got any questions about his society? We got one. I got one here. Okay, I'm just gonna take the microphone to him.
Hi, I'm Cage. Hello, I'm Cage. I just want to know, I'm hyperactive, and I've been smoking marijuana since I was 13, and it helps me a lot. Now, to ask the doctor, gave me this in the early days, you never could get it. Now I'm still trying to get it to get the help for myself to keep nice and relaxed, so I can sing, enjoy what I like to do, and I would like to join you to get the help for it. Think you can help me?
Well, you would have to go see your doctor, and you'd have to get a statement of diagnosis for the hyperactivity at the very least. and then we can help you out. Yeah.
Okay, thanks very much for that.
Okay, let's move on to some alternative non-smoking ways of using cannabis. And before I do that, we're just going to do our little commercial break for a second.